So I have some good news for everybody. The Guardian reports, Japanese flu drug clearly effective in treating coronavirus, says China. Shares in Fujifilm Toyama Chemical, which developed favipiravir, surged after praise by Chinese officials following clinical trials. Medical authorities in China have said a drug used in Japan to treat new strains of influenza appeared to be effective in coronavirus patients. Japanese media said on Wednesday, Zhang Xinmin, an official at China's Science and Technology Ministry, said favipiravir, developed by a subsidiary of Fujifilm, had produced encouraging outcomes in clinical trials in Wuhan and Shenzhen involving 340 patients. It has a high degree of safety and is clearly effective in treatment, Zhang told reporters on Tuesday. Patients who were given the medicine in Shenzhen turned negative for the virus after a median of 4 days after becoming positive, compared with a median of 11 days for those who were not treated with the drug, public broadcaster NHK said. In addition, X-rays confirmed improvements in lung condition in about 91% of the patients who were treated with favipiravir, compared to 62% of those without the drug. But the Japanese Health Ministry source suggested the drug was not as effective in people with more severe symptoms. We're given Avigan to 70 to 80 people, but it doesn't seem to work that well when the virus has already multiplied, the source told the Mainichi Shimbun. The same limitations had been identified in studies involving coronavirus patients using a combination of the HIV antiretrovirals lopinavir and ritonavir. I don't know how to say these names. The source added. In 2016, the Japanese government supplied favipiravir as an emergency aid to counter the Ebola virus outbreak in Guinea. Favipiravir would need government approval for full-scale use on COVID-19 patients since it was originally intended to treat flu. All right, so here's the issue. Here's the issue. This drug works, but it only works with mild to moderate cases. For the most part, by the time people show up to the emergency room, they have severe cases. And at that point, the drugs don't work. That's quite a pickle. That's quite a conundrum. And then if people start showing up with mild to moderate symptoms at the hospital would be so overrun so quickly that people wouldn't even be able to get the drug in time, I don't think. Or there wouldn't even be enough of it. But so the good news is, yes, we have something that treats it. The bad news is it's only for the mild to the moderate cases. Now, at the same time, there are other tests going on, and, they're trying to develop a vaccine as soon as possible. I think they're already starting the trial for the vaccine, but experts say best case scenario, it'll be a year before we get a vaccine. But it is good that there are some antiviral drugs that are having some positive effects. The other thing is there's been a story floating around about Cuba is claiming that a version of interferon that they're using works in fighting this virus, but we don't have any studies yet on that, and we just have to take the word of the Cuban government for it. So, hey, listen, if I'm in one of these situations where I have it, yeah, I want to be one of the people in the test trials because I don't want to wait, because the longer you wait, the more you develop the virus, and it sucks. So I'm happy that we have something that fights it, but it definitely is a conundrum that it's only for mild to moderate cases. So we got to throw everything we got at this thing, man. It's that simple. Scientists all around the world should be working together. We should be studying that Cuban drug right now. We should be doing further studies on this drug, and we should also be trying to get a vaccine and also trying to get something that works even for severe cases. But it's kind of crazy that, we're caught flat-footed on something as basic as health, because definitely in the case of the U.S., we spend trillions of dollars on wars And then we didn't even do basic pandemic preparedness. We don't have enough masks. We don't have enough ventilators. We don't have enough ICU beds. I mean, we don't have tests. We don't have the freaking tests, guys. The tests. I mean, come on. So, I'll never forgive and I'll never forget that our government spent trillions of dollars for war and didn't even do basic pandemic preparedness when every expert has been telling us for the longest time, oh, we know a pandemic's coming. It's just a matter of when, not if. So it's inexcusable. But if I, was the president or if I was in the U.S. government, I would do everything I can to get my hands on even these antiviral drugs that are somewhat effective. And I would definitely fast track it to get it into people's hands as soon as possible. So I guess this is some good news for the crisis, and we're not used to getting any good news, so I'll take it.